Gurfata community, which is located within Gwagwalada area council, is one of the oldest and historically significant communities in Abuja. However, despite its long-standing presence, the community has suffered from decades of neglect and is currently grappling with severe infrastructural, educational, healthcare, and water supply challenges. The primary healthcare facility in Gurfata was constructed in 2005. For a brief period, it served the health needs of the residents. However, for the past 10 years, the facility has been completely abandoned. At present, there are only 2 health personnel managing the facility, which is grossly inadequate given the health demands of the population. In the neighboring settlement of Pofuna, which is also part of this catchment area, there is just 1 staff member handling the healthcare load. This situation is made even worse by the fact that Gurfata is not just serving its own people, but also several neighboring communities, altogether comprising about 5 to 6 communities that depends on this already overwhelmed and under-resourced health center. The hospital infrastructure has deteriorated significantly and now in a depleted state, lacking even the most basic medical equipment and essential supplies. When it comes to access to clean and safe water, the community is in dire straits. Although boreholes were once installed to provide potable water, none of them are currently functional. These water resources are broken down over the years and have not been repaired or replaced. As a result, the entire community now depends solely on stream water for all their daily needs, including drinking, cooking, and sanitation. This stream water is not only unsafe for consumption, but is also insufficient to meet the needs of the rapidly growing population.
And they will be vomiting, and something will come out from their body. This is what she said. And at times, women, if they go to hospital, they will say the water they are drinking is one that causing them all these problems, especially those that carry belle. That if they go to hospital, they always that they say the problem is from the water. And at times, this water is only this year that they are getting the plenty water. If not, every year they used to come here in a crowd, they will be fighting, and they will be injuring each other on the process of fighting because of the shortage of the water and because of the population.
Currently, Gurfata has a population of over 3,000 people. With such a significant population, access to education should be a fundamental right. Unfortunately, the junior secondary school in the community is also in state of neglect. The school, which previously enrolled over 200 students, has been abandoned. There is no single classroom that can be accommodating for learning and teaching activities. When it rains, the school is forced to shut down, and students are sent back home due to lack of shelter and infrastructure. Even the teachers have no designated office or storage areas for their materials. They often have to borrow space from nearby residents, using someone's house or room as a makeshift storage area for their teaching resources. This is clearly not a suitable or dignified solution. The dream of education is slowly fading for children of Gurfata, and the implications for the future of the community are devastating. The people of Gurfata community are in a state of urgent need. They face critical challenges in healthcare, access to clean water, and education. This is a call for immediate intervention to the government, help restore hope and improve the living conditions of this neglected community. The residents are not asking for luxury, just basic human needs and dignity.